Good morning, everybody. I will call the October 5th Wright County Board of Commissioners meeting to order. Please stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Good morning, everybody. We're going to be doing some rearranging because we do have somebody that's going to be online here shortly. So we'll be moving up the COVID update under items for consideration when that person joins us. So to start off with, let's do the minutes. Dispense with the reading, approve as written or revised from September 28th.
Chair, I'll make a motion to approve the minutes from September 28th.
I'll second that.
Motion by Commissioner Houston, second by Commissioner Vetch. Any further discussions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous. Review and approval of the agenda. Does anybody have anything they need added or changed other than what I had just stated regarding changing?
Mr. Chair, I'll make a motion to approve the agenda as presented with the modification of the COVID update when it fits best.
I'll second.
Motion by Commissioner Vetch, second by Commissioner Wetter. Any further discussions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous. Consent agenda. Does anybody have anything they would like removed for further discussion?
Mr. Chair,
Commissioner Ketchmark.
under letter B, administration, number 2, the transfer of the $824,000.
Okay. Anything else?
No, that was my request too.
All right.
I'll make a motion to approve the consent agenda with item B2 hold for further discussion.
I'll second that.
Motion by Commissioner Ketchmark, second by Commissioner Hewsome. Any further discussions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous. He's still not online, right? Oh, he is. All right. Dr. Morris, thank you for joining us this morning.
Good morning. Yeah, good morning. Did I get my sound right?
Yep.
Sounds good on our end.
Perfect. Thank you, guys.
Sarah, why don't you go ahead and
Sure.
let us know what's going on.
Yeah, Jake, you can stand over there. So Jacob and I have been working on our COVID response, primarily planning vaccinations. However, in some conversations about vaccination planning with our healthcare systems, we came to understand just exactly how stretched and stressed their healthcare systems are right now, particularly in the central region because of our high case rate. And we wanted to make sure the board was aware. And I know Dr. Morris is here to kind of give us, I think, a better perspective than I could ever do about what they're experiencing in their systems with the cases. I think I would preface, we continue to outpace our neighbors in the metro with our case rates. We are generally in the top 20 counties for positivity. And while some of our partners like Stearns have been a little bit faster, you can see that we're experiencing some exponential growth in our case rates, just 3 or 4 weeks after school, including more than a doubling of the number of childhood cases that we're seeing for people under the age of 18. So we can talk a little bit more about that, but I want to make sure we are respectful of Dr. Morris's time. I have provided with them a really brief update. In writing, it showed the regional ICU capacity use. But if you want to talk a little bit more, Dr. Morse, about what Center Care is experiencing in the region, that would be helpful.
Thanks a lot, Sarah. And thank you, commissioners, for your time. And I know I'll probably speak from a broad perspective of Center Care and maybe some specifics for each of our areas. Sarah, as you said, the healthcare systems are in essence full. I'll say that both for the statewide and for greater Minnesota. The statewide data for COVID hospitalization patients, we can see that on the MDH website and many of the media things. One interesting thing is that recently patients admitted with COVID in outstate, greater Minnesota, is surpassing the numbers admitted in the 7-county metro area. And if you think about that from a population perspective, they're 3+5 million, and the rest of Minnesota is a much smaller percentage, but now we have more admitted patients in our facilities than even the metro area. And Wright County, you're kind of right on that edge. We look at our hospitalized patients, and I know our large facility is St. Cloud, but we include Monticello, Redwood, Caris, Rice. So for all of our hospitalized patients, and we serve that broad region of 7+ major counties, 20 for our referrals for that. And our rates of COVID positivity also reflect that. So we track both what the state puts out for county by county data, and then we also track with what our own lab services, clinics, and hospitals are seeing. And our test positivity rate is above 13%. So that means 1 out of every people that we test is turning positive. And we're testing a lot of people. We're running over 8,000 tests, on a weekly basis, and we're identifying about 1,200 people. So this is not a case where, we're only testing a small percentage of people, and that's why our rates are high. We're testing more now than we've done at least since, the winter surge, November, December. And we're seeing that case positivity rate that's higher even than it was in the spring. That's also carrying forward for our numbers of people hospitalized. We look at all the patients hospitalized with COVID, and then we also look at the ICU ones as you kind of laid out. So our numbers of hospitalized COVID patients today was 84. And that's throughout all of our systems, with over 66 of them being in St. Cloud Hospital. It's just an amazing number. It far surpasses the peak that we were at back in the spring. It's about half of what we were in November, December. I'd like to say it's not as bad as the November, December one because we have been vaccinating. We do have our more vulnerable population, the 65 plus, that got that first wave of vaccinations. Our challenge now is obviously we're also seeing those vaccinations wear off. After that 6-month period, the immune response is going down, which is why we're really promoting the boosters, especially for our 65 plus. In the 84 patients that we have admitted to the hospital, as of today, about 20% of them are vaccinated. So that means 80% of our COVID-related admissions are unvaccinated. Of the 20% that were previously vaccinated, all but 1 of them are over the age of 50. So again, in that more vulnerable category where we know the immune response wanes. So that's kind of where our effort. So this truly still is the cases and the hospitalizations are in the unvaccinated patients. And, Sarah, as you said, our vaccination rates in greater Minnesota, Wright County, Stearns, Sherburne, Canby, Ojai, many of the other counties we serve are lower than the state average. Now, we've been able to get our employees vaccinated at a higher rate than that. So our employees overall are at 72%. Our physicians and our APPs are at 96%. So we really do see that difference. We see that our healthcare workers, it's 72, it's not 95, but we're working on getting there with our employment requirement. Our ICU level care. We've had to expand our ICU. Usually our ICU is available for all the routine healthcare needs that each of us may have in our communities, whether that's heart attacks, strokes, or accidents, or high-level medical needs, high-level surgeries. Currently, our ICU has over 23 people that are there for COVID. And that's over half of our ICU capacity, even with this expansion. We've had to expand into our CICU and our other cardiac units to basically take over their ICU space to dedicate it to COVID or other COVID-related conditions, which unfortunately brings that reality that means we're not able to meet the other healthcare needs of our communities. We're delaying surgical procedures. We're unfortunately delaying what's called elective surgical cases, but truly for each of us that may need those, they're not elective. They're just time sensitive, or we may have the ability to delay them a little bit. Well, the longer we delay them, the more complications we see, the more of a challenging procedure it is, and the more healthcare effects people suffer while we're having to delay their care. Trying to think of other things that might be helpful. Pediatrics, again, we know the school systems. The cases going up in the schools, I think MDH does a great job with tracking that, reporting it. We're seeing a lot of outbreaks. Our pediatric clinics are full, our pediatric walk-in is full, our family med clinics are full, and obviously we're seeing a lot of these cases where it's, I believe, over 26% of the positive cases are in kids, younger kids. We know that they're not eligible for the vaccine yet in that 5 to 11, so we're really trying to see what can we do to help protect them. We're looking at our behaviors, our travel. We know what's coming with the fall. We know what's coming with potentially COVID and influenza season. Our pediatric patients are already seeing what's happening with COVID and RSV. So that is one of the things we're seeing this summer is when you get the dual outbreaks, it becomes a challenge, and we're trying to anticipate, well, what does that mean for the future? So I understand, Sarah, you asked me to kind of paint a little picture. I apologize if it's a little bit of a bleak picture. It's a beautiful day outside, but we'd all like to be spending more time out there. I think we understand there's a little bit of awareness of what our current situation is, but more would be what questions do you have, and then what can we do even now to kind of help lead us into a different future.
My question, Dr. Sarah, Jacob, on the update sheet that we got, it says that new cases per, is it supposed to be 100,000 people or 10,000 people?
Oh, sorry, 100,000.
Okay.
It says
from the
100,000. Mine says 100,000.
I think there's a zero missing at the end.
Is there a zero missing?
Yeah,
So I didn't know if it
that's
was
my
10
fault.
or 100.
Oh, I see.
So that's,
And I'll say one thing. Sometimes it's reported as new cases per 100,000. Some calculations are new cases per 10,000. I've seen it both ways on different databases, even from the state. And I apologize if that is part of our data confusion. As we look at the new case rates, whichever, you judge it by 10 or 100, they're all in that red category. Basically, every county in Minnesota would be classified as red, meaning high viral activity, high case rates, which leads into that what's described as sometimes uncontrolled growth.
so that's taken from the CDC COVID data tracker. So that is primarily what we're using with, that's where the CDC and MDH school guidance comes from. I'm not in the Teams meeting, but I can, and I can share what the map looks like, but we do that after we're, had all the questions of Dr. Morris, but other than actually Cook County is orange right now. But this is only up to Sunday's information, and we took in quite a few cases over the weekend, so I anticipate that our case rate will be significantly higher. Double the number of cases that we have been seeing for most of August in the past 3 days.
Does any of the commissioners have any questions for Dr. Morris?
Mr. Chair, I've got one. Just
Yeah.
kind of interested, the rates are going up, but the testing availability is way down. Like right now, anybody that has mild symptoms, you're lucky if you could find a place even in Wright County to be able to get a test within 24 hours.
You likely cannot find a place in Wright County for testing within 24 hours unless maybe you go see your provider, and your provider is only going to see you if you're symptomatic.
Right.
Stellis just changed on Monday to require that you have an urgent care visit. We talked to their manager on Wednesday as well. They were doing 75 cases in 3 sites across the county in November. In December, when we had our largest surge, they've been doing 125 a day so far and since school has started. So the demand has really, things started scaling back in July, right? Because and many of these are private lab providers, and if they don't have the business, they move on. And now the business is back and they're not able to meet the demand. Not to mention many of our test providers are also pharmacies, and they have a dual job now of both testing and vaccinating. So I think it's very difficult to meet the demand within the community. Our schools are very much, and our parents are very much struggling trying to find those testing, and without, there's a lot more close contacts, because if they were masking in the schools or in any place, if the 2 individuals are a close contact but they're both masked, then you're not considered a close contact. So usually it's 6 feet in 15 minutes. You probably have heard that many, many times over the past almost 2 years. But if both individuals are masked, then that can be discounted as a close contact. So it helps in the school setting, it helps in the workplace setting, but with none of those happening, there's a lot of concern and a lot of close contact conversations happening with families. So there's a lot of demand on the system.
Anybody else? Dr. Morris, just to get down to the nuts and bolts of it, if I had a heart attack, chances are it'd be difficult to get into a local hospital because of the lack of ICU beds and that sort of stuff, or, you know, for somebody with an emergency, what are the issues?
That's a good question. We still have the capability and capacity to manage heart attacks. The challenge becomes if you have that heart attack, that's usually like a quick, let's get you done, what are called STEMIs, but there may be delays. You know, there could be a delay in the ambulance services. You know, there could be a delay in the emergency room if we have 5, you know, heart attacks all at the same time, and the space and the staff are getting limited. One thing that we're seeing is that even after you're what's called stabilized for that initial heart attack, and now you need your bypass, well, that bypass in the previous world could have happened the next day. Well, now we're seeing, no, it's going to be 3 days, 4 days, 4 weeks. So there's oftentimes that's part of the delay. You know, as we use that term elective, elective is a relative term, and I don't think anybody that needs a bypass wants to be labeled elective, but oftentimes due to our capacity, those are. And that's part of what's being shifted. Emergency rooms are having very long extended waits. You know, as Sarah, I believe, described, some of the urgent cares don't have the staff or the capacity to spin up as fast as they need to, and they've kind of slowed down. Emergency room waits that are even beyond what we've had to do in the past are getting extended. And people are having to travel farther to get the care that they need. We're seeing more virtual care. These are things that we had to really lean heavily on in that fall-winter surge from November, December. And that's kind of where we're really close to that kind of level. You could call it triaging care, crisis level of care, where we have to do things that are beyond our normal capacity.
Sarah, you said there was only one urgent care in Wright County right now?
So that's correct. We have 1 to 2 urgent cares open any day. Center Care is not able to open the urgent care or the ICU in Monticello, and you can correct me if I'm wrong, Dr. Morris. There used to be 2 in Buffalo.
Yep.
When the clinic reopened, they were not able to open or staff the urgent care, so there's just the Stellis urgent care in Buffalo. Hopefully it will help by pulling their testing into urgent care. That will help sustain that urgent care. And then the only other one that we have is the one in Delano. When I called Ridgeview to let them know what I was hearing from the other systems, they let me know they've had to close that urgent care on days because of staffing issues.
Yep, and I believe if I remember correctly, the urgent care at the Monticello Hospital was a joint venture, our space, but typically staffed by the Stellus providers.
Correct. And they can't
And
open
that's
it.
where and it's just due to some staffing and people in need early on in the summer, they likely shut that down and now don't have the staff to spin it back up.
All right. Any of the commissioners have any other questions? Thank you very much.
And I know I appreciate your time. Yep, a lot of this may be just a conversation, and if there are action steps that you're thinking of taking, we would be looking for any support you can offer regarding increased education about vaccinations, benefits of mask wearing or mask requirements, social distancing. We are kind of looking for how do we help communicate with the public from a lot of different voices. So thanks for your time.
Thank you, Dr.
you.
Morris. Appreciate it.
Thanks.
To Dr. Morris's point, we are working on a joint letter between the systems and my division to the schools to let them know exactly what our health systems are experiencing. They've certainly seen the increased cases, some of them more than others. It's not, obviously COVID is not, it's a virus, it doesn't follow a lot of rules, so it's not equally distributed. So some schools are feeling it acutely and are making some changes, and some are not and are kind of holding on to their current. But to be clear, none of our schools in Wright County are following the MDH or CDC guidance. Some of them make some of the same recommendations. Some of them are doing contact tracing and notifying parents. Some are not. It's quite a variety of COVID plans, but none of them are following the CDC guidance, which begins with masking, but also includes contact tracing, quarantining close contacts.
All right,
Mr. Chair.
Commissioner Leiter.
Sarah, the flu vaccine now, are you going to be administering both?
We have employee flu clinics already planned.
Yep.
Do you think that that's going to be, since there isn't mask mandates right now, generally, do you think that we'll see more flu cases, and do you think they'll be able to figure out whether it's flu or COVID?
So there are different viruses and there's different tests, so I don't anticipate an issue with determining which. Right now, what they're working on is to make it one swab, because nobody really wants to be swabbed twice, let's be honest. But one swab and be able to test for both. Right now, they do a flu swab, not a COVID swab. We did have cases of flu start to go up, and particularly in our childhood, 0 to 4, we were seeing flu across the state, as well as RSV, as you heard from Dr. Morris. So they were trying to discern which type of respiratory viruses we were seeing. That came when there wasn't as much COVID. But I think we anticipate a difficult flu season, yes, because there aren't those social distancing, masking, stay-at-home orders, et cetera, that we were abiding by last fall. And we already have it, as I mentioned, we already have seen it in the community.
I've seen it, okay.
All right, we'll continue the discussion under items for consideration if we want to. Let's get back to our regular scheduled broadcast. All right, Commissioner Ketchmark, you had pulled under Administration Finance, item B2.
Right, thank you, Mr. Chair. So we had requests for board action today for the approved transfer of $824,209.51 from the general fund to the capital improvement fund, and under background justification, it noted this is needed because we didn't bond enough for the construction of the tactical training facility. The sale of the bonds was based off an estimate cost, and that wasn't enough of a justification for me, I guess, not being here on explaining what was all going on during that process. So I reached out to finance, I talked to Ryan, and besides the conversation, he also sent 3 attachments. One was 423 pages, one was 21 pages, and I still have some questions, so thanks to the staff for coming in today. I'm wondering on the timing for one thing, because the smoke just cleared on the budget for this year, and I'm wondering what impact this would have had it been addressed a couple weeks ago, if it could have been, or about the timetable that it came up a week after we approved next year's budget, if there was any impact or strategy there.
Mr. Chair, Mike, Commissioner Kaczmarek. Yeah, so we were just notified, Alicia's, Alan notified Alicia that the project is closed and all the bills have been paid out and all the retainage was paid to the vendors. So at that time then, I ran the report to figure out what the shortfall was, and that's what I brought forward to the board.
So it was just a coincidence?
Yep.
Okay, and I just can't help but think, as we poured over the budget for so long, and meeting after meeting, you sat next to me here, that's how it worked out. So I just wanted to inquire if it was related at all. And another question was, what was the amount spent on? Because it's not a general figure, it's actually down to the penny. And I'm wondering what these extra expenses were. I know there was a consultant, an engineer and designer involved, and estimates and all that. So there was estimate costs, a couple of them it sounded like, but do you have any breakdown of what the extra costs were that amounts to this figure?
Mr. Chair, I'm going to help here on this discussion because I was very much involved in one of those ones. So the history on this is that we went into scoping the estimate with Contegrity. Contegrity is not a firm that we weren't aware that these types of facilities are very nuanced and very unique in their cost structures. But Contegrity gave us an estimated cost on the building. Now, later when we started getting down to the nitty-gritty of it, we realized that there is aspects of a training facility, especially with an indoor firing range, that has much different requirements that Contegrity was not aware of. So we then contracted with RJM. And when RJM scoped the work, they ended up finding out that the blast walls in the back were substantially more expensive than what Contegrity thought. The ventilation system that was necessary was vastly more expensive than what Contegrity had put in there. And then there was also just some other pieces that when we got into it that we were forced to make some change orders because that Contegrity wasn't quite sure, or I wouldn't say sure, it wasn't their bread and butter. They tend to build more office space type buildings, where RJM builds these type of fire training tactical type buildings. It was kind of one of those situations, if we would have used RJM from the get-go, that cost, that $824,000 would have been part of the cost estimate, and it would have been on budget or potentially under. But because our Contegrity bid it with not having the specific technical knowledge of that type of facility, they underestimated those costs. So that's kind of the nuts and bolts of the situation.
Okay. Commissioner Kaczmarek, I'm assuming you've been out there
I have.
When you were as a deputy, you were out
I
there.
was, right.
Commissioner Water, have you been out there yet?
No. I've been outside of it.
I would urge you to just go out and kind of have a tour on what they do out there. It's really unique. I'm sorry, Commissioner Kaczmarek, you have additional questions?
I do, thank you. So I looked at a couple different estimates and trying to figure out what the final cost actually is of the building. Could you break that down a little bit?
Well, total cost is $9,593,136.05.
Now, is that Wright County's cost, or does this include the contribution from the FBI?
That is the total cost of the construction of the building.
That was in the ballpark of what we,
And does that include the $824,000 then?
Yep.
Okay.
And,
So the revenues were $8,768,926.54. So then the difference is the $800, but it's needed to make the cash balance zero.
Okay.
And the FBI provided us, was it $2 million?
2.2, and we had about 200,000 plus of emergency management funds that we would accrue over time to pay for some of the other build outs for the what do you call it,
The range or?
no, the EOC, I'm sorry, I can't, all the acronyms.
Yeah. Emergency Operations Center.
Oh, that's what I was just
Thank
gonna
you. I was
ask,
like,
what's EOC?
So the agreement was the one-time contribution from the FBI, and then the rest was Wright County's cost?
Yes.
And what's that time frame or that contract? It's like so
30
many years,
I
right?
think it's 30. 30?
I'm not sure.
I should know that off the top of my head, but I want to say it was,
Yep, Chief Deputy
it was
says 30.
renewable.
Okay, so now we're 2 years into it, so there's 28 years left. After that 28 years, does it get reopened and revisited, or do we tell the FBI to find another spot? I never heard how that was, what's gonna happen in 28 years.
It becomes, yeah, Wright County's.
You'd
but-
renegotiate your contract if they want to continue use, but then at that point, there could be a revenue stream at that point, because their 2.2 million contribution is for that period of time. It's kind of like they're fronting their rent, per se.
Okay, and I think the last question, but these expenses for the 824,000, are these things like dispatch and the radio tower and things we've looked at before that the Wright County agency only benefits from, or are these things that as a whole, everybody using the facility benefits from?
I can't pinpoint what the dollar is for what expenditure it was. I'm just saying the 800 is what's needed for the expenditure for the whole project. I can't say what it was used for.
Okay.
If that makes sense.
Well, I just, because it is to the penny, so I'm kind of wondering that there was a time and a figure that ended with the estimate, and then, okay, we're over, so all these things contribute to that 824,000. I'm kind of wondering what all those things are, if we know.
Well, there's the fiber that wasn't out there that we thought there would be capable broadband out there that there wasn't. And when we did it, we scoped it higher with the hope of that there could be some other utilization from people in that area. We haven't gotten to that point yet. That's still part of our whole broadband committee discussion. But we did put fiber in there. We did make it possible that there could be additional strands in there. So, because we figured if we would ever create a loop, we'd want to use that as part of that loop. So some of those things all kind of increased to why the budget of it went up. There was some cost to it because when we did the debate, it was originally not going to have the upper level training space to it, but we realized that the cost of doing it later would make it ever cost prohibitive from happening. So we looked at spending the extra couple $100,000 and putting that second level training and having it indefinitely was far smarter now than to have to build a separate structure if it was ever needed later. So it's a lot of those nuances, but a large amount of it was the indoor shooting range and the wall coverings that was necessary for it. The bullet catcher, which was an optional choice, but it was very, very expensive. I want to say it was to the tune of like $90,000, wasn't it? Something to that? I don't recall, but it was a very, very expensive piece. And then the ventilation was another one that really drove the cost.
So the approval of the change orders as they went were by the board rather than consultants or engineers and designers? Is that how that went?
Alan probably
Yes.
is, but yeah.
Okay.
Mr. Chair, Commissioner Ketchmark,
Morning.
I think there's maybe a misunderstanding here. What I gather is you're saying that there were change orders or changes to the project that was this cost. That's not the case. This project was awarded over bond cost. So when we awarded the contracts for construction, there was already that delta. It wasn't additional pieces that were added on during construction or additional elements that was that cost. It was awarded with a gap to start from the beginning of awarding the construction contracts in 2019.
Yep.
So I think there's maybe, correct me if I'm wrong with, that's kind of what I was thinking that you were getting at was there was a gap due to changes to the site. The changes happened, or the cost estimates were different from the design phases to the actual bidding process. When RGM did the estimate, we bonded in the middle of that phase. So we had the bond funds before we got the final estimates to award contracts. So that delta was there when we awarded the contracts for construction.
Okay, well, and
We bonded too low because we went off bad information.
Correct.
Yeah.
Yep.
And thanks for explaining that, Ellen. I guess I'm back to a sentence and a half here that I had to work with to start. All right, Commissioner Wetter had some interest. Did you have any more?
I think it pretty much got answered. I guess my question mainly was, are the books okay they're taking from the general fund and replacing it and putting it in CIP, that would still be all right supposedly? Because, I mean, I'm looking at almost $1 million here, yet we're transferring and.
Mr. Chair, this was a known expense. So when we did the budgeting here and we made the buy down on the budget, that was known to us. It didn't put us in any kind of a predicament. It was literally, that money was kind of, I guess I would say, in our mind, earmarked in the general fund, knowing that funds was gonna have to come out at some time. Our fund balance is still is healthy, given all the moves that we have made, because they have been known and strategic and planned out, so.
Okay.
All right, with that, I'll make a motion for the approved transfer of $824,209.51 from Fund 01, General Fund, to Fund 34, Capital Improvements Fund. These funds are to cover the shortfall of the Wright County's Sheriff's Office Training Facility.
Second.
Motion by Commissioner Ketchmark, second by Commissioner Leiter. Any further discussions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous. Attorney Brian Alison.
Morning, Mr. Chair, Commissioners.
Yeah, we're a little late, sorry.
And I know too.
No worries. The action item is to adopt a resolution approving a supplemental assessment role for service charges in the Charlotte-Martha Subordinate Service District. You'll recall that about 6 weeks ago, we had a public hearing regarding these supplemental service charges. And the purpose for them is to take care of the shortfall in the dedicated fund for that sewer district. Greg Kreiser has threatened me that I needed to take care of this before I exit my work with the county. And of course, I've been involved in this project for 20 years now. So the request is pretty much self-explanatory, but I will mention a couple of items. One is that on the list, the assessment roll, there are two parcels. One, about in the middle of the first page, the name is Jack and Sherry Simmer, S-I-M-M-E-R. They're the landowners. They're being assessed for $5,400. Yeah. This is a case where sometime after the project was installed, they combined a couple of tax parcels into one tax parcel. So there's only one tax parcel, but they have enough land where they were originally assessed for hooking up their house and for an additional stub for future connections. So there's basically two charges or two connections on their property. Similarly, in the second page, about 2/3 of the way down, the name is Mark and Sandra Nelson, and theirs is the same situation where they're being assessed $5,400. Both of those parties I wrote to prior to the public hearing to let them know that, you know, this is why they were being assessed that. In the case of at least one of the two couples, they had bought the property in the last 3 or 4 years, so we wanted to make sure that they knew why they were being assessed double. And I did not hear from either party. The other, I've got a couple of aerial photos here. There were a couple of items that came up at the public hearing, and I thought should at least mention these to make sure that you understand that they're resolved.
Is the light on there, Brian?
Oh, I do it. I need to turn on a switch, I imagine, huh? Power switch? Right here? Oh. Okay, so the first one was an individual that spoke at the public hearing. His name was Jeff Reed, R-E-E-D. They reside in the parcel that's outlined in blue and also own the parcel next door outlined in yellow. Both of those were obviously assessed for a trunk charge at the time of the original project. Mr. Reed was questioning the parcel outlined in yellow simply because he said there's drainage across that property. The Rockford Township owns the parcel across 9th Street from their parcel, and that drains through that parcel outlined in yellow. Tammy's office was good in providing me some records back to when the original project went in, and it was examined by the engineers at that time, and they determined that that lot was buildable. And so I communicated with Mr. Reed and told him that we were still planning on going ahead with an assessment against both of his parcels, and I haven't heard a response. The other one actually came up after the public hearing. Individual by the name of Lon Voigt owns a parcel south of Lake Martha, outlined in blue. And with this one, we did a little research, and this parcel was originally unbuildable, but after the sewer project went in 2001, Mr. Voigt petitioned the Board of Adjustment to rule that it was buildable because of the sewer project being available. I think the reason it was unbuildable is there simply wasn't room for or sufficient soils or whatever for a septic system. Once the sewer project went in, it was ruled buildable. Mr. Voigt built a shed on the property about 3 years ago, and that was why he was asking that this parcel not be assessed. He actually lives over on Lake Charlotte, so this is an extra parcel that he owns. I checked with planning and zoning. They said, no, it's buildable even with the shed on there. There is room for residents, and there is a sewer stub assigned to that parcel. So they felt it was fair to assess that parcel as well. Again, I communicated with Mr. Voigt by email, and I have not heard back from him. So I just wanted to make sure that you knew that we had at least taken a look at those two where people raised questions at the public hearing. So other than that, I'm here to answer questions. Tammy's office has indicated that they will communicate with the residents to allow them to prepay without interest. In the chapter that deals with special assessments by cities and such, it's 30 days. There's a period of 30 days from the resolution from the governing authority during which parties can prepay. Here, because we're doing it under a different chapter of the statutes, I just suggested that a cutoff date of November 15th would be probably nice. It allows them a little bit extra time to do the mailing. But, you know, that was always part of the discussion, is that we would allow people to prepay without interest. And so we expect that a good portion of the residents will do that.
Brian, back to that very first one that came to light at the public hearing.
Yep.
Where they stated that there was stormwater or something that went right through the middle of their property?
Oh, wrong one.
So that lot, even with that, I'm assuming it's stormwater, but there's still room for them to be able to build a house on it?
So I've not done an on-site inspection. What I don't know is whether or not the situation has changed since 2001. What I was able to determine from records was that at that time they there was a question. There were probably 10 or 15 parcels that the engineers took a real close look at because people said, well, we don't think this lot is buildable. In 2001, they determined it was buildable, and I'm reasonably certain that the drainage pattern was the same at that point. So there is some natural drainage across that lot. I'm assuming there may be a culvert underneath 9th Street, but I don't know that.
Yeah, the way he talked it, that there was actually a manhole or something.
Yeah,
I
it
thought.
sounded like that.
Yeah, so but you've
Have to
reached
go
out
out
to him to
there.
let him know, so he hasn't replied back.
I haven't heard anything.
Okay, all right. So, anybody else have any questions at all? If not, I will look for a motion.
So moved, Mr. Chair, to adopt a resolution approving the supplemental assessment rolls for service charges in the Charlotte and Martha Subordinate Service District.
I'll second that.
Motion by Commissioner Batch, second by Commissioner Houston. Any further discussions? Hearing none, roll call vote. Commissioner Ketchmark.
Aye.
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 Resolution carries unanimous.
Thank you.
Brian.
Brian?
Morning, Matt.
Thank you, sir.
We're almost on time.
Good morning, Mr. Chair, members of the board. I have 4 items for your consideration today. The first is to approve the 2021 ditch assessments for expenses from October 2020 to September of 2021. So you can see we have 5 ditches that we're recommending assessing this year. One would be County Ditch 10, County Ditch 38, Joint Ditch 3, which we are not the host, Joint Ditch 14, and Joint Ditch 15.
Mr. Chair,
Commissioner Ketchmark.
thanks for coming in, Matt. So is this where we're gonna go over the tier of assessments as part of this also?
Yep, we were gonna do that in item number 2, but
Okay.
yeah, we can address
Well, if
that.
they're
right now.
separated, then we can leave them separated.
Okay. So yeah, these are the ones that we'd be assessing this year. The list of the other expenditures is shown there. While, some of these are held is because of redetermination of benefits and other factors like that, just the amount that each ditch has. We usually assess a ditch when it reaches a certain account balance. So that's just a brief description of why some of these we're not recommending assessing this year.
Anybody have any questions?
Yeah, Mr. Chair.
Go ahead, Commissioner.
About what normally is an assessment, the average assessment? I mean, does it depend on how much ditch it's is on their land or because I would imagine some of those that are benefiting that are way, way far from that ditch. How does that figure in?
Yeah, the viewers would figure in what's called the proximity ratio. So the farther you get out, your land is still classified as a certain type of land. It's either an A, B, C, or D acre, or a 1, 2, 3, or 4, depending on what viewer views. But the farther they get away from the ditch system, there's a reduced assessment on those acres.
Oh, so there's some formula that they okay.
It's very complex. It's what they call an if-then.
Typical, okay. So then what is maybe the average, like for ditch 10, that's a large amount, so what would you say the average assessment would be on someone?
It's hard. We have one, and I was discussing it with Commissioner Kaczmarek the other day. He owns quite a bit of land, and he owns land right along the ditch, which is obviously higher value land. His assessment after County Ditch 10 is done is close to $300,000. So we're talking he owns a significant amount of land.
Yeah.
So that depends. It depends on how much land they own, where it is, and what that land is currently used for.
So it's all numbers, all
That's why
types
it's
of assessments.
Yeah, that's why this tier, and the interest rate and how long they have to pay off, which we'll be discussing next, is really important because some of these assessments are quite large, and allowing landowners to pay that off over a period of time is
So what
really
if the
important.
landowner himself cleaned out his area of the ditch.
Yeah, no, that's a great discussion. You know, I brought it up in a drainage work group meeting because we have a lot of trees on the ditch systems, and, you know, some landowners keep up with the trees and others don't. You know, there's no way to separate that assessment if, you know, if the landowner on the upper end of the system still pays to clean out the outlet of the system and vice versa. So that's something set in drainage law that I don't necessarily agree with, but.
I was gonna just state another unfair practice in the ag community. Okay. All right, that's.
Anybody else have any questions? Not, I'll look for a motion.
Mr. Chair, you know, this was kind of a discussion too, is like, were we ever going to have that discussion about trying to make sure that we get these balances in a positive venture at some point so that we wouldn't be in, I guess, building up debt for these systems? That was kind of the thing. And I guess it was a question about what, and maybe at some point we'll have to workshop that, to have a discussion of what is allowable for us to do. Because sometimes it's easier to take a small bite over time than to all of a sudden, like we've had some of these systems are getting just hit with huge repairs because we just.
They hadn't been done.
They haven't been done, you know. Trying to prevent these people from ever getting big assessments like that again in the future, but.
Yeah, and that's a tough one. And going back to what we just described, you know, if we did a small repair at the outlet, you know, maybe the person upstream doesn't get the benefits unless you clean it all the way to them, but they're still paying for that repair. So that's where it's hard, and that's where sometimes you get into where a full repair is almost needed, but it's expensive. So it's definitely one that, you know, we obviously take very seriously, and I've all sat down with all of you and discussed ditches at length and just about the assessment part of it and what that would mean. So it's definitely something we don't rush into.
Commissioner Wetter, you know, when these things were done back in the early 1900s, they were designed for a specific purpose, and that was for the farmers.
Yes.
But they've come to be utilized for other purposes as a rural stormwater now, which is why their reassessments are looking at the property that's farther away is fair.
I understand that, yeah.
Mr. Chair.
Commissioner
It's hard
Ketchmark.
to explain.
And one way property owners can benefit with the tree removal is if you kind of put out there for the people that burn wood, you can come and take the trees for free. And then nobody's gonna be assessed for that removal, because they pretty much measure per foot of tree removal. So if you got a bare spot there, it'll benefit you, but it'll also benefit everybody else, and you're not having to swing the axe out there yourself. Also on the projects, when we take a close look at these, there's some that drain through small sloughs and little lakes, and we really take a close look to see, is it draining good enough, or do we have to spend a lot of money on what is specialized mobile equipment, floating excavators, and bring those in, or is it actually flowing to an acceptable level? And I think that's important. A lot of times you can look at it and it looks like it's gonna find its way through. It might not be the most direct route, but that's where a lot of expense comes in. And I don't think everything has to be fixed right away. And we found that there's gonna be some hangups from some of the other agencies if we broaden the scope of the project sometimes versus a concentrated effort. And that's worth something too, because you could prolong a whole project because you have to jump through the hoops of 2 or 3 other agencies. So we really take a close look to see what's absolutely necessary to keep that flow going.
Yep.
Mr. Chair.
Commissioner Wetter.
And then, of course, there's those that if you clean downstream and the farmer and many have their tile going into it, and oftentimes when it's cleaned down, or I should say upstream, when it's cleaned upstream, then it's backing up into their tile, so then they have a flooding problem, which Matt knows.
If you clean an upstream section, the person downstream pays for it, and they're getting more water on them.
Yep, and then it'll back up into their tile, and so then they suddenly have a problem.
And that's one of the reasons why we're also working with Soil and Water
Yeah.
to improve water quality. with
Yes.
storage and that sort of stuff.
Oh, yeah. Many basins are being done right now. Many basins.
Mr. Chair, I'll make a motion to approve the 2021 ditch assessments for the October 20 to September 2021.
I'll second that.
Motion by Commissioner Vetch, second by Commissioner Hewsome. Is there any further discussions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous.
Item number 2 is listed as to set the interest rate. I do think it'd be worth a discussion, you know, to settle the payment tiers as well here. Last year's interest rate was 2.5%. The sheet that I just handed out to you shows the different interest rates for a few neighboring counties, but also shows the amount of time that they give them to pay off those assessments. So our payment tier is broken down into 1, 3, 5, 10, and 20 years. You know, there is discussion, you know, about County Ditch 10 in particular, but I think it might be wise to just do an all-encompassing payment tier. I think the biggest question that I received is if there's something we can do in between the 10 and 20-year assessments. So the 10-year assessment would be anything from $10,000 to $50,000, and then 20 years anything 50 and above.
So
assessment.
What are people asking?
To potentially increase that amount of time that they would have to pay off, especially in the 10-year. You know, so if a landowner has let's say a $49,000 assessment, our current tier allows them to pay it off over 10 years. I think there would be much appreciation if they had 20 years to pay that off.
Mr. Chair.
Commissioner Ketchmark.
And I've had conversation with quite a few landowners along 10. We can use it as an example because it really is a very big, expensive project. So we're learning a lot from it. And it seems like it would be more palatable if we had the 10-year payment window for the cost of $10,000 to $20,000. And that's up to $2,000 per year per landowner. And if you're assessed over $20,000, then you'd jump down to the 20-year payment plan. That's just what Matt and I had come up with for discussion here with the board here to run it past you, and this could apply to any of the ditch projects really across the county.
Yep, I agree. Yeah.
And the interest rate, 2.5, my phone's not ringing about the 2.5%. Is that workable with the rest of the process here?
Yeah, I think comparatively to some of the other counties, it's pretty low. So.
Yeah, I think it's a fair amount. I would also like to change, like, if it's over 100,000 to go to 25 years. Especially for the one person, it's a lot of money.
That's a huge assessment.
And to give them an additional 5 years to help. And it's up to them on whether or not, I mean, they can pay it off early if they want, it's up to them. And a lot of it's going to depend on crops and pricing and all that sort of stuff.
Oh, yeah. Mr. Chair, I will set the rates with the modification of taking the 10-year to 10,000 to 20,000 and setting the rate at 2.5% again for 2021.
And we're adding the 25-year?
We can add the 20 if you want to put the 20. I mean, I guess you can have it out there. I mean, somebody may or may not use it, I guess, with the addition. If you want to add a 100,000, I guess from over 100,000 you go to 25 years.
A very unique situation, but
Yeah, it would be.
Yeah,
But,
it's,
Yeah, I think, but as we improve some of these other ditches where we need to improve the water quality, you know. On ditch 10, we also did receive some funding from, with the help of Soil and Water through Bowser or something, or Clean Water or something.
yeah, last I checked, we've, in total over the past 4 years, we received 560,000.
So without that money, these would have been a lot more.
yeah.
So that was very nice of Soil and Water to work with us on these.
Absolutely, yeah.
Okay, so your motion did include that 20?
Yeah, but
25?
so basically we're doing items 3 and 4 together. Yep.
All right,
I'll second that.
Motion by Commissioner Vetch, second by Commissioner Ketchmark. Any further discussions? Hearing none, all those in favor say aye.
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 Opposed, same sign. Motion carries unanimous.
All right, so item number 4 is to discuss the allocation and charges for the agricultural and drainage coordinator, or my position. It's changed quite a bit since I started. When I originally started, we allocated 50% of my salary, including benefits. It was changed to 25% in 2019, and then was reduced completely in 2020, and I believe we are back to 25%. So I just wanted to have a discussion about that for next year's budget. We did talk about it at my budget hearing. I think we were at 25% of my salary and benefits. But the main question is, we currently allocate that based off of the length of a drainage system. That's what other counties tend to do. So we follow that model, but we do have the scenario, and probably Vetch knows more about it than anyone. Some of the ditches that we don't do work on or are basically impossible to repair due to wetlands and public waters, they still get allocations, for no work being done on the drainage system. And I don't foresee us being able to do anything in the near future unless the laws change. So some of these larger systems, when we're basing it off of length, they get quite a bit of an allocation for my salary. So if there's a way that we can do that, that doesn't hurt those systems quite as much.
Mr. Chair.
Commissioner Vetch.
So this is kind of the ongoing discussion we've had over years, because I have a few of them in my district, as well as Christine does. These systems that are literally kind of dormant systems, but because we can't abandon them because there still is some sort of benefit. Yeah. So, literally there's no information going into Drainage DB for them. There's literally no hearings taking place. Literally Matt does nothing other than just charges part of his wage for essentially nothing. I have a hard...
Does he take phone calls?
No, because they're people... I really, it struggles, but usually because there's a road crossing, and that's the reason we can't abandon these systems, or there's a railroad, and so for that fact, it just sits there in just as wetland. I guess I was more in favor of the fact of either doing one of two things. Either we charge back that 25% to systems that Matt works on, or we charge it to the general fund. It was easier just to go to the general fund because it wouldn't have to spend so much time calculating which ditch systems did I work on, and then figuring out based on those systems, how do I allocate it out based on the footage. You'd spend a lot of time calculating. It was just easier just to back out that 25% on the general fund side of it, and it's cleaner.
Mr. Chair.
Commissioner Ketchmark.
And on the side of, I guess, accountability and transparency, and from a guy that's kept a log of his daily activity for a long, long time, I would like, if someone calls and says, hey, how come I was assessed this amount, we would have Matt, hey, we can break it down to if it's a half hour or more, a quarter hour or more you spent on the phone, you drove down to ditch 10. It's 20 minutes each way, and you're 20 minutes out there, that's an hour. And then these folks that are getting no service from the ditch drainage coordinator aren't paying. I'd kind of like to see what that looks like for the folks that don't need anything. And I think that it kind of better relays where your time and money is going. And we can work with you with some type of a log sheet or whatever it is, but this is people's money. We want to be accurate and be able to justify and defend how we're picking the rate that we're picking and who we're billing.
And I think, another one is, this Thursday we have the township officers meeting, talking about noxious weeds, which I took over this year, and it'd be nice to see kind of how much of my time is spent with noxious weeds and how much is buffers and ditches, and I think that'd be an important part of the calculation too, for future billing is, because if it's, we're billing that 25%, but I only work on ditches 75%, that price goes up. So if Janice and I spoke about, if it was just a flat billable rate per hour on a ditch, and then I wouldn't assess anything for noxious weeds.
Mr. Chair, I guess the question is if we have two routes, either we assess it against where the work is being done, or we make it the general fund. I'm just kind of curious the amount of time that's going to take for it to calculate out. I don't want it to be the point where we're literally spending more time calculating it out than the time working on the system, or even 50-50. I don't want it to be, especially when you're talking 25%. We're not talking a large amount, like all of your wage. We're talking a small percentage of it, so it's kind of like you're spending a lot of time to split up that dollar amount.
Well, as a commissioner that has no ditches, except for maybe a few feet, is it fair to my district?
Is it fair for us, for myself and you, to pay for child support or child protection cases when you don't harm your children? I mean, I could go that case on everything, you know. There's a lot of services that we do as a county that we're paying for things even though we don't get those services, so.
And Mr. Chair, they,
Gotta bring it out.
I gotta always use my same counter.
the benefit of landowners still have to pay for any repairs, you know, for reestablishment of records, and that, so they are still paying for that. It's not, that's, Matt's part is probably relatively, I mean, it is relatively small compared to what the repairs and all the other things, reestablishment or redetermination of benefits.
What are we talking about, 20,000?
Yeah, probably give or take.
It's something like that, yeah.
This is basically the administrative part of it. I mean, other than we're still charging back drainage DB, which I'm okay with that, you know.
Right, because I mean, he might be looking at ditch, but he's also looking at noxious weeds and how do you know, how, the way he's out there, you know? So then you start kind of, you know, almost nitpicking, and is that fair, and is it worth his time? I don't know, Mr. Chair, I think I'm moving toward what Commissioner Vetch is proposing, because it's not a large dollar amount, but it would certainly save him on a lot of time.
Mr. Chair? Thank you. Is this is revisited annually, is that right? Or based on the ditch projects coming up? I haven't been through it before, so how often do you revisit the tier?
It's been an evolving process.
Yeah, we've debated it every year because we're trying to, because what happens is he sends these assessments out, and this letter that's in here, that justification as to why they're being assessed this dollar amount, him and Jan are going to get a number of phone calls, especially from these systems that literally have never had anything done and probably will never have anything done, and going, okay, why am I getting an $150 bill? Because you don't do anything. Are you going to do anything? No. And wait, so what's this for? For administrative costs. Administrative of what? Nothing. You know, and they're doing this phone call after phone call after phone call. So it ends up becoming a large time suck of their time suck. Is that a bad word? I don't.
And you might get a call, and then you have to call them to find out, and so it gets kind of complex.
Yeah. I just want to be good stewards of their time, because I don't want them to try to explain something that's going to be very difficult to explain, because, especially for systems that aren't going to get any word.
Yep.
You know.
Well, we talked about this, Matt. You're the keeper of all this. How does it sound to you as far as feasibility and time management? What do you think is workable for you?
Yeah, I mean, I think just due to evolving job duties, you know, outside of the agricultural and drainage work, it would be very hard to track all those 5-minute phone calls and meeting with landowners and stuff. I still think it's worth doing for a period, just so you understand where my time is generally allocated to. So if you wanted to, say, maybe pursue noxious weeds more aggressively after our meeting, you know, we could say, hey, you're only allocating this much time, let's try to allocate more of that. And just kind of, my position was a newly created position here at Wright County, so it's still somewhat evolving.
Yeah, it went
Mr.
from
Chair,
drainage to egg, including egg.
Mr. Chair, I'm going to make a motion to remove the 20% or 20 or 25% of Mr. Matt Detchen's wage from the assess, or general assessment across the ditch systems. But I'll also say yes to the, if you want to do some, time tracking just for some better information down the road, that'd be excellent, so.
I'll second that.
Motion by Commissioner Vetch, second by Commissioner Wetter. Is there any further discussions?
Mr. Chair?
Commissioner Ketchmark.
And I guess I think it'd be good to review this at the beginning of ditch season, if there is such a thing, because we might change according to the projects that are coming up. If you're gonna have one that's gonna take the majority of the time, we might wanna adjust that right up front, just because it is evolving across the county. That's all. Thank you.
All right, one quick question regarding noxious weeds. Is that just strictly for townships, or does it also deal with the cities and stuff too?
It would be, yeah, countywide, but this is for, I was asked to speak at the township officers meeting on Thursday, and I believe it was about noxious weeds.
I'm just kind of curious on
Mr. Chair.
if I can contact you for about city info.
Yeah, you can.
Chair.
Commissioner Wetter.
The SWCD, Kerry Saxton used to be the noxious weed person. And he just, wherever he saw it, if he saw it in a city, he would contact the city to do something about it, because even the townships, you contact the township if they want to do it, take care of it, or if you want us to, the county to come in and do something about it. So, that's all, just some background for you.
Okay. All right, we have a motion and a second. Any further discussions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous.
Thank you.
Thank you,
Matt.
COVID-19 update. Does anybody have any questions for Sarah?
Didn't we already do
Does
that?
anybody want to discuss it further at all at this point? All right. We'll move on to scheduling a deferred compensation committee meeting.
Yes, Mr. Chair, there are a few discussions I know have taken place about deferred comp. I think it would be good to have a meeting of the deferred comp committee to discuss that. Recommendation would be to put it on our upcoming committee day, which would be the 13th, and just add it after the Ways and Means, which has already been scheduled, so that'd be 10 a.m. on the 13th.
We have deferred comp. I can't even remember the last time the deferred comp.
It meets very infrequently. We have both.
I think it's been years.
It very well may be. On that is Commissioner Vetch and Leiden as the two commissioner reps. So
next Wednesday?
That would be the recommendation, yes.
And on the, let's see, October 13th at what time?
10 a.m.
So that's, Mr. Chair, that's Minister Kelly, that's the two committee members, not
Is
committee of
there-
the whole.
Correct, yep.
Is there already a committee meeting at 9 already that day?
There is a Ways and Means that day.
I just have something I gotta make it to into the cities at 11, or can you do like earlier, Mark, 8? Or 8:30?
I can do 6.
Can you say?
Oh, gee.
I don't think Mr. Kelly will go for it, but.
Get here, figure it out.
No, 8 is fine by me.
8 is fine?
Do 8 o'clock.
Fine with any of that?
Okay.
Or 8:15 or.
All right, we'll go for 8 o'clock then on the 13th.
Mr. Chair, I'll make a motion to set the deferred compensation committee meeting for October 13th at 8 a.m.
I'll second.
Motion by Commissioner Vetch, second by Commissioner Ketchmark. Any further discussions? Hearing none, all those in favor say aye.
Aye.
Both same sign, motion carries unanimous. Item 3.
We had discussed adding another broadband committee meeting to the calendar. Was looking at the week of the 18th or perhaps later, just to keep the discussion moving. Knowing we have already on the 19th a meeting following the board, one consideration could be to go out another week and look at the 26th at 10:30.
And that's not of the whole, that's just for the,
Yeah, me and you.
Smaller group, correct.
October, what day are we looking at? The
26.
26th? I'm fine with that.
10:30, 11?
10:30 is good.
10:30, yep, right after the board meeting.
Okay, we need a motion for that?
Mr. Chair, I'll make a motion to set the broadband committee for October 26th at 10:30.
I'll second that.
Motion by Commissioner Batch, second by Commissioner Houston. Any further discussions? Hearing none, all those in favor say aye.
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 Opposed, same sign. Motion carries unanimous. Next week, for workshop, does anybody have any other things they'd like to have discussions? I'd like to add one. Compost facility. Some things have changed. I think it's something we're going to probably have to have more discussion of next week. Otherwise, License Center and Dental Clinic and compost. Any other things anybody would like to have a discussion next week on?
Mr. Chair,
Commissioner Wetter?
I'd like to talk a little bit on the waters of the United States, or WOTUS. Just to explain a little bit about it, you've seen it on AMC's emails and what I've discovered about it. Nobody seems to know anything about it, and I did a little research, so it would only be about 5 minutes.
Okay. Anything else? All right. We don't need a motion for that, I don't think, do we?
No.
No, I'll
Consensus is that, just
wanted to make sure we captured the topics if there were those to add, and we will agenda that as appropriate for next week.
All right. Committee minutes. Commissioner Vetch, Budget Committee of the Whole.
So on September 27th, was that last week on Thursday, we met as a group, and as you can see, as the others present, I think we were pretty resounding large attendance. To make a modification to the budget as it came forward to the board the week previous. After that, at that meeting, some different information had come forward to us as to what the tax capacity would look like, as well as what our fund balance, a better fund balance information. With that, we were able to make some modifications to bringing down the levy from that 6.6 original down to a 5.75 by using some excess fund balance. The fund balance amounts that we are using is less than we've used in previous years and still meets our financial goals of calling bonds in the future. So business, it looks good and the numbers are good, and which we already set that preliminary levy at this time, but those are the minutes from that meeting.
Did you say Thursday?
Was it Thursday the 27th?
No, it's Monday.
Oh, Monday the 27th, yeah, sorry.
Because we had to approve it on Tuesday, so I wanted to make sure I wasn't hearing things.
Yeah,
And I missed it.
all the days
Okay.
blur together.
Yep, understand. Just want to make sure though. All right, so we have a motion. Do I have a second?
I'll second.
Motion by Commissioner Vetch, second by Commissioner Ketchmark. Any further discussions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous. Commissioner Ketchmark, the Committee of the Whole regarding compost facility.
Yes, September 27th, we made a field trip site inspection out to the compost facility. All commissioners were there along with other county staff, township official, and other citizens. That's informational only as we toured the grounds out there. I'll make a motion to approve the Committee of the Whole minutes from September 27th.
I'll second that.
Motion by Commissioner Ketchmark, second by Commissioner Houston. Any further discussions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous.
And the next Committee of the Whole was September 28th. All the commissioners were there. other county staff. First item was the compost facility. Commissioner Ketchmark mentioned that there were improvements noted at the site from the first visit to the second visit. Just to summarize it, Commissioner Ketchmark thought that the facility should be closed due to safety concerns and that the county should look at other options, which Auditor Treasurer Bob Hebel is already doing. Commissioner Vetch stated that he thinks there has to be a reset at the facility and suggested that staff should gather pricing information for scrapping the metal at the facility before the facility is closed, and that we should try and find an alternative solution to continue services. Assistant County Attorney Kreiser stated that he does not know if there is an alternative solution at this time. Commissioner Hewsom stated a lot of ideas were discussed during the tour, multiple options. Her biggest point noted was the approximately $30,000 needed to heat the processing building every year, and that the county needs to create an efficient system for recycling for the residents. Facilities Director Alan Wilczek stated the county previously looked into the price of disposing equipment, and it would have cost the county more money at that time because the scrap prices are down. He noted because of the change in market, maybe that scenario has changed. Commissioner Vetch questioned what the cost to demolish the building versus clean out the building and modifying it to fit operational needs would be. Wilczek stated a civil engineer had offered to provide site planning services. Wilczek questioned what the long-term plan is for the use of the facility. Commissioner DeLine noted that the site should provide composting and hazardous waste services. Risk Manager Dahl stated that he toured the Stearns County facility and that they offer a lot of various services for their citizens regarding recycling. Commissioner Ketchmark questioned the status of the fire suppression system. Commissioner Dahl responded that that is outsourced. He will gather information on that and distribute it to the commissioners, and it is unknown, according to staff, what fire suppression material would be the best based on what is stored at the facility. Commissioner DeLine suggested issuing a request for proposal to repurpose the facility. Commissioner Ketchmark noted that Wright County has a solid waste management plan that was approved by the MPCA, which includes that the county shall have an advisory committee to review initiatives and make recommendations. We currently do not have that committee. Commissioner Vetch added that the environmental health officer position is still on hold, but the position has been posted. Human Resources Director Sean Johnson stated that he's not aware of any applicants at this time. Evala stated the solid waste management plan was formed in collaboration with the state. If changes are made to the plan, the state needs to be notified. Commissioner Wetter asked if the county has contact information for the MPCA. Kreiser stated the contact is located in Duluth. Recommendations, there are 9 of them. Number 1, administration will issue an RFP for future processes and uses of the site. Planning and zoning will work on improving the solid waste management plan with assistance from the attorney's office. Planning and zoning will reduce the materials on site. Wilczek and Dahl will work to minimize safety risks while keeping the facility operational. Wilczek will determine the feasibility of scrapping metal and equipment. Department of Natural Resources will be contacted to request an alternate site for the storage of equipment. Evala will continue to research options of outsourcing the entire operation, focusing on hazardous waste. Wilczek and Dahl will look into forklift, baler, and front-end loader opportunities. And number 9, an update will be provided to commissioners in November. With that, I'll make a motion to approve the minutes from the Committee of the Whole on September 28th.
And the recommendation.
And the 9 recommendations.
Second that.
Motion by Commissioner Ketchmark, second by Commissioner Hewsom. Is there any discussion? Alan?
Good morning, Commissioners. Can I just ask a clarification on the recommendation for the DNR's relocation of equipment? Is that still a recommendation, given the discussion about key access for the site? Are they still being requested to remove their equipment as that recommendation stated?
That's a good question. I had, just for an update, I had a conversation because a lieutenant from the DNR called and said that 2 enforcement agents that had stuff out there tried to access it and found the keys, the locks were changed and couldn't get in. So I put him in touch with Alan to get the keys and preferably a key holder list and a form. And it doesn't sound like they have another option right now, but they're willing to work with us. However, whatever our requests are. So they just don't have another place. So when you talk to them, I think that they can still be there. Now, Attorney Kreiser said that they have a liability waiver that's, I think, completed. I don't know where that's at as far as delivery, but that's all part of the mix here too, if they're gonna continue being out there, I would think.
So just, I guess, to clarify, we're not looking to relocate. Is that accurate? So that recommendation from the committee of the whole should be pursued or not pursued?
Mr. Chair, I think I'm okay with them at least for the, for the next, 60, 90 days going forward with it. I mean, or even if you give them through this winter and then we can.
I'd say through the winter.
Through the winter, and we can reevaluate this at sometime in April, but until further notice, we'll just continue.
Because we don't know what and how we're gonna do everything.
Exactly, as my point, Mr. Chair,
But the waiver is sooner the better, I think.
Oh, absolutely.
Yeah.
Yeah,
Thank you.
thank you.
If I could, Mr. Chair, Commissioner Kachmark, we're dealing with a lease that includes a waiver of liability, just so you know. We're working with them, I think it's Grant Wilson, that's the correct name, I believe, with the DNR right now on that. So we're clarifying that up and we'll get it executed soon.
Thank you, and I guess if you talk to Grant, Greg, just make sure he maybe keeps his enforcement supervisor in the loop, because he didn't even know the locks were changed, so we're working with that.
Well, that's probably kind of our fault, but. Is there any further questions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries unanimous. We have a 10:30 leadership meeting, so unless somebody has something that is extremely critical that needs to be talked about for the advisory committee, advisory board updates, I would wish to forego that to get to our next meeting.
I can hold mine off.
Could I have a minute, Mr. Chair?
I'll give you 30 seconds.
30 seconds. Follow up on the Historical Society trees. That contest, if we so choose, that would you put up after November 1st and then have all of November to work on your tree. Then you would take down after January 1st.
All right. Anything else? We are adjourned at 10:28.